Welcome to the GlucoRx training video on the Trend Injection Technique Matters guidelines and GlucoRx dual safe pen needles. This training video has been produced using resources from the Trend Diabetes Injection Technique Matters 2023 guideline. An electronic certificate will be available upon request after completing the training video. The Trend Injection Technique Matters guideline is designed to inform and support healthcare professionals in the best practice recommendations regarding insulin and GLP-1 receptor agonist injections for patients with diabetes. Today's training will include information on how to select appropriate injection sites and rotating between or within them, the easy-to-follow 10-step injection process with details on the skin fold technique, complications and troubleshooting surrounding poor injection technique, some additional areas for consideration such as the mental impact of using injectable therapy and the guidance for injection technique during pregnancy. The training will then finish with information, recommendations and safe use of safety pen needle devices. Firstly, let's start with the importance of selecting the correct length of insulin pen needle. A 4mm needle or a lifted skin fold should always be used to ensure the treatment is deposited into the fat layer known as the subcutaneous. Insulin pen needles should never be reused, and complications of reusing needles is something that will be covered later in the video. So let's break down the different layers and why the fat layer is recommended. Firstly, a patient's skin is approximately 3mm thick, so the insulin needle only needs to be long enough to penetrate past this layer and into the fat layer. Historical use of longer needles, such as 6mm, are not required. The fat layer thickness will vary greatly from patient to patient, and this can be due to multiple factors such as age, ethnicity, or even which site they have selected for their injections. As mentioned, the fat layer, or subcutaneous layer, should be where the treatment is deposited. This is because there is a stable blood flow to this area which aids in the absorption of insulin and GLP-1s. However, if the patient injects too deeply and treatment is deposited into the muscle layer, then there is an increased risk of hypoglycemia and suboptimal glucose levels. This is because the blood flow in this layer is highly dependent on activity levels, so is therefore less stable and steady compared to the fat layer. Next, let's look more closely at which sites your patient should be selecting for their injections. Approved sites are the back of the upper arms, the abdomen, the upper buttocks, and the upper outer thighs. All of these sites are suitable for use if the patient is using analog insulins and GLP-1s. However, for human insulins, the rate of absorption of delivery can differ depending on the site. The preferred site for soluble insulin is the abdomen, as it's absorbed more quickly here. The preferred sites for NPH insulin are the thighs and buttocks, as it's absorbed more slowly here. The preferred site for pre-mixed insulin is the abdomen in the morning, and then either the thighs or the buttocks in the evening. It's important to regularly rotate within each site to avoid overusing the same area for repeat injections. Firstly, select an appropriate site for injection and divide into sections. The abdomen can be split into quadrants. The remaining sites can be divided into 2 sections each. Next, the patient should be advised to change sections on a weekly basis, and no section should be used more than once every 4 weeks. Finally, injections should be rotated every time within each section, with each injection being approximately 1 centimetre away from the previous. To summarise, it's important to select the site of injection based upon the type of medication or treatment being administered. Each site should be split into 2 or 4 sections, and these should be rotated weekly. Every injection should be at least 1 centimetre away from the previous injection within the same section. The 10-step injection process is a quick, concise and easy method to follow for ensuring correct injection technique is used every time. The following steps are designed for patient information. Some additional guidance on this process will be covered later in the video for when safety pen needle devices are used to provide a healthcare professional point of view. 1. Wash and dry hands. 2. Remove the pen cap from the insulin pen. For cloudy insulins, roll the pen 10 times within your palms. 3. Invert the pen gently 10 times. 4. Select a new needle and remove the paper tab. Never reuse needles. 5. Apply the new needle to the pen and remove the outer cover. 6. Check the patency of the needle by holding the pen upright and performing an air shot with 2 units of insulin. 7. Dial the required dose. 8. Insert the needle through the skin at a 90-degree angle and inject the dose fully. 9. Count to 10 before withdrawing the needle from the skin. 10. Remove the needle and dispose safely via a sharp spin. The next section in today's training will cover the complications arising from poor injection technique and how to troubleshoot them. Lipohypertrophy, also known as a lipo, is a hard area under the skin formed of thickened, rubbery fat tissue. A lipo is very common, affecting at least 2/3 of patients who use insulin, and they can vary in size and shape. The primary causative factors of lipos are incorrect injection site rotation, or not rotating at all, the duration of insulin use, frequency of injections, and reusing needles. The images on the left demonstrate examples of lipos, with the ones on the inner thigh and lower abdomen being clear to see. Lipohypertrophy can be a cosmetic concern for many patients, but injecting into them can cause its own range of health complications. It is estimated that patients who inject into lipos use on average an additional 15 units of insulin per day. Looking at the bigger picture, this poor technique is estimated to cost the average healthcare organisation up to £30,000 per year on additional insulin required. This is because injecting into lipotrophic tissue can cause severe glycemic variation, leading to increased occurrences of hypo and hyperglycemia, tiredness and fatigue, poor HbA1c outcomes, and therefore more long-term complications of diabetes. Here you will see an example of a severe lipohypertrophy. If the patient were to continue to inject into this site, it will severely impact the way the insulin is absorbed and its subsequent efficacy at controlling glucose levels, resulting in huge glycemic variation. Healthcare professionals should teach correct injection technique during the first initiation of insulin and GLP-1s, but also at each review to ensure their patients are injecting safely. During reviews, there are 12 points to consider when examining for lipos. Ensure there is good lighting in the room to look for any changes in the skin surface. Always gain consent from the patient prior to starting an examination. Visually look for changes in the contour of the skin. Wash hands prior to starting the examination and try to ensure they're warm. Apply water-soluble gel to your fingers. Try to use the tips of your fingers to firmly examine the skin and the underlying tissue. Use a massage motion to work your fingertips towards the suspected area of lipohypertrophy. If possible, push deep into the tissue through the fat to feel the muscle below, then push forward towards lipohypertrophic tissue. Feel for a change in the subcutaneous tissue. Document the size and location of the lipo if found. Advise the patient to avoid the area for at least 3 to 6 months. Re-examine at the next visit. Another complication of poor technique can be bleeding or bruising. Occasional bleeding at injection sites can occur, and this can be an indicator of poor injection technique, such as pushing or jabbing too hard with the needle, inserting the needle too deeply into the tissue, or moving the needle around whilst it's inserted into the subcutaneous layer. All of these situations could result in microtrauma at the injection site, and this is more common in patients who are taking anticoagulants and antiplatelet therapies. It's important to note that there is no evidence of bleeding or bruising having a negative impact on glycemic control. Healthcare professionals should provide additional information on correct injection technique in patients who suffer from this complication, highlighting the importance of using a new needle for every injection to prevent the distortion of the needle tip, and a reminder on how to correctly rotate between and within injection sites. You can also ask to observe the patient's current technique to determine their process and advise on how to increase comfort. In the meantime, applying pressure with a cotton pad or tissue after injection for a minute or so should stop any bleeding. We're nearing the end of today's training, with the next topic covering some additional guidance around injection technique during pregnancy and special considerations to take regarding the psychological impact of requiring injectable therapy. During pregnancy, the skin on the abdomen stretches to accommodate the growing baby, and many women who inject insulin are concerned that the injection may penetrate into the womb. If using the recommended 4mm needle, reassure the patient that this is highly unlikely. There isn't as much research into the best injection technique during pregnancy, so any recommendations are based on expert opinion and individual experience. During the first trimester, the abdomen is still a safe site for injections using a 4mm needle, even at a 90-degree angle. Once the pregnancy progresses into the second and third trimester, patients should be advised to use either the sides of the abdomen if they can reach, as shown in the diagram to the right, or into alternative sites such as the upper outer thighs or back of the upper arms. Healthcare professionals should discuss the patient's psychological and emotional concerns regarding injection therapy and encourage them to express their feelings and any fears. This may help to overcome any potential hurdles to optimal injection technique. At commencement of injection therapy, you should aim for a positive and therapeutic environment to maximize the effectiveness of injection technique training. Any negativity during this stage could lead to long-term issues with treatment, especially if the patient feels they are being punished for poor diabetes management, for example. Support for ongoing self-management of their injection therapy should be given, and the patient should be included in the choice of the regime appropriate to their needs and lifestyle. Educational programs should be developed for the individual patient according to their needs, physical functioning, cognitive functioning, culture, and emotional well-being. When demonstrating correct injection technique, healthcare professionals may wish to consider using distraction therapies, stories, or imagery devices for patients who are nervous of the procedure. If a patient is nervous of administering their own injection, then there are devices which can support this process. Additional information on these are available in the Trend Diabetes Healthcare Professional Booklet 2023. The final section of this training video incorporates the guidance surrounding the use of safety sharps and how to correctly use the GlucoRx Dual Safe pen needles. All healthcare professionals, employers, and employees must comply with relevant national and local legislation for the use of sharps. The Health and Safety Regulations 2013, Sharp Instruments in Healthcare, states that the employer must substitute traditional, unprotected medical sharps with a safer sharp, where it is reasonable and practical to do so. The term safer sharp means medical sharps that incorporate features or mechanisms to prevent or minimize the risk of accidental injury. Healthcare professionals who may require the use of safety sharps are noted below, but some examples include those working in care homes, community teams, and primary-secondary care settings. Trend Diabetes advises that healthcare professionals should be involved in the selection and trial of all safety-engineered needle devices, and that training should be provided to ensure safe and accurate use. The GlucoRx Dual Safe pen needles are a passive safety-engineered needle device. This means that pressure needs to be maintained with the skin during injection. Then, the safety shield automatically activates when the needle tip is withdrawn. The double-ended automatic safety mechanism helps to prevent users from accidental needle stick injury or bilateral exposure. This is when the needle penetrates the patient and the healthcare professional's skin during injection. The shield will activate after injection to cover both ends of the needle. A skin fold technique must be applied when using the GlucoRx Dual Safe pen needles to help maintain pressure on the skin, as described previously in this training. A reminder is also provided on the following tutorial video. Welcome to the training video on the GlucoRx Dual Safe pen needles. Here we will be covering how to use best practice technique to ensure safe and efficient injection. To begin, please ensure you have clean hands and you are wearing gloves. Remove the pen cap and roll the insulin pen 10 times in the palm of your hand. Invert the insulin pen 10 times. Remove the paper seal from the GlucoRx Dual Safe pen needle. Holding the outer cover, push and screw the needle onto the insulin pen in a clockwise direction until you feel resistance. Our GlucoRx Dual Safe pen needles have a universal fit on all insulin pens. Next, pull off the outer cover. You will notice two separate parts to the safety needle, the white body and the coloured safety shield. Next, ensure the insulin pen is in an upright position and check the needle patency by expelling 2 units of insulin, also known as an air shot. A small amount of insulin may be visible through the viewing window of the coloured safety shield. This is usual. If you do not see any insulin leave the tip of the needle, please repeat the air shot process. You can then move on to dial the prescribed dose on the insulin pen. It is essential to use the skin fold technique with the GlucoRx Dual Safe pen needle. This will allow for you to actively see the needle penetrate the skin surface and ensure enough pressure is used to activate the safety mechanism within the needle. To perform the skin fold technique, raise a fold of skin between the thumb and fingers. Try not to pinch the skin too tightly. Make sure you do not grasp too much tissue to avoid raising the muscle layer. You will hear a loud click when the needle has successfully pierced the skin and the needle has been correctly activated. The white capsule will not sit fully flush with the skin surface. Please ensure this step is completed successfully before administering the insulin dose. Unsuccessful completion of this step would be evident if you do not hear a click. In this scenario, there is the potential for insulin to pool in this area and not be administered appropriately. For the purposes of this demonstration, we will be using a stress ball to mimic the patient's skin. Insert the needle through the skin at 90 degrees. As you can hear, the safety shield will click once the needle has been correctly inserted. Inject the dose fully and count to 10 whilst holding the skin fold. You can then remove the needle and then release the skin fold. On withdrawing the needle tip from the skin, the safety shield will automatically deploy and lock into place. A red inner marker will be visible through the viewing window to indicate the needle has been used. This is a useful check to determine the needle has penetrated the skin surface and administered the dose of insulin. Please note there may be a small amount of insulin visible through the viewing window on the safety shield or on the patient's skin surface after injection. This is because of the insulin left in the shield after an air shot, and we would expect to see this. The original 2 units of insulin expelled during the air shot could be present at either of these sites. You can be confident you have not underdosed the patient due to holding the needle in position for 10 seconds before removing. Lastly, remove the safety needle by unscrewing from the insulin pen and dispose of it safely in the sharps bin. You will notice the second safety shield on the connection end of the insulin pen needle has also been activated. Please ensure the sharps bin is placed so that you don't need to pass the needle from hand to hand for disposal. Thank you for watching the GlucoRx training video on the Trend Injection Technique Matters Guideline and GlucoRx Dual Safe pen needles. Today we have covered the Trend Diabetes Best Practice Guideline for Injection Technique Matters, how to promote this correct technique to patients, complications arising from poor technique, additional advice surrounding injection therapy such as the emotional impact and what to do during pregnancy. We finished the training by covering the importance of using safety sharps where necessary and how to correctly and safely use the GlucoRx Dual Safe pen needles. For any additional information, questions or resources, please find the details on the screen of our dedicated UK-based customer care team. The team can be reached Monday to Friday between 8 AM and 5 PM, either by phone, email or our online chat feature on the GlucoRx website. An electronic certificate will be available from your healthcare team lead upon request. Thank you for watching.